my heart went into tachycardia, and my heart rate was about 270 beats a minute. I walk into the front desk at the range, and I was telling the guy, I'm like, "Hey, I don't feel good. Call 911." So there was actually a guy right next to me named Bob, who's a paramedic, and he's like, "What's going on?" I'm like, "I don't know. I'm super lightheaded. I feel like I'm going to pass out." So he went and sat me down on the couch and tried to do a bunch of, he's a retired paramedic, so he's trying to do a bunch of things to kind of get me to calm down, and I couldn't come out of it. They're like, "You're in tachycardia. We're gonna have to shock you. We're gonna have to defib you." And they put me an IV, and they're like, "We're gonna give you some stuff so you don't feel it, but you're probably gonna feel it because we don't have enough time. So we got to get this done." So they ended up shocking me. Felt like Mike Tyson just knocked me out. Saw this big flash of light, and then all I remember is waking up probably 6, 7 hours later in the hospital with tubes in my mouth, and they started pulling the tube out, and I threw up.
Dr. Troy, and this is going to be our first episode. So let's
Yeah,
hit it. Dr.
let's
Troy
do it.
Darling, please tell us why the heck it is that you do. Why do you do what you do? What is it that you do? And do you do what you do?
That's a great question. Everybody always asks, why do you do what you do? Why are you always so happy? And, it really comes down to my personal experience. When I was 12 years old, I was riding a three-wheeler and I fell off the back of a three-wheeler, knocked the wind out of me. I thought I was going to die, couldn't breathe. And I remember I was at my grandparents' condominium and I climbed up these stairs, barely breathing. They're like, "Oh my God, what happened to you?" And I'm like, "I don't know. I fell off the three-wheeler. I went off a jump, landed flat on my back." And the next day I couldn't stand up and I couldn't, I was bent over like a jackknife forward. And my grandma's neighbor said, "You need to go to my chiropractor." So long story short, I go to the chiropractor. He fixes me up. I was able to walk again after a few weeks. And I never really thought about it until I got into high school. I was playing football and I got injured playing football, hurt my shoulder, couldn't even lift my shoulder. And I was like, "What am I going to do?" And so a friend of mine said, "Hey, go to my chiropractor." So I go to his chiropractor. He does his chiropractic thing and fixed up my shoulder. And when I was getting ready to go to college, I was like, "Gosh, what do I want to do?" And my grandpa said, "You should be a pharmacist." So I went to a college in out of state where I'm at, checked out pharmacy school, and thank God for out of state tuition. I didn't do that. So I went, "You know what? I'm going to be a physical therapist because that's what chiropractic is." And so I went to Eastern Washington University, got all the prereqs to do physical therapy. And here I go again. I'm bodybuilding, working out, and I mess up that 12-year-old, knock the wind out of me, three-wheeler, low back injury. I jack myself up doing deadlifts, can't walk again. So what do? I'm like, well, chiropractic helped me before. I might as well go to this chiropractor. So I go to this chiropractor in Cheney, Washington up in Eastern Washington, and he was talking to me. He's like, "What do you want to do when you grow up?" And I said, "I want to be a physical therapist because that's what chiropractors do." And he really leaned into me and told me why I should be a chiropractor and maybe not go down the physical therapy route. And right there and then I went, "I'm doing chiropractic." So I had personal experience all going through that. So I was already on in line to become to go to chiropractic school. So with all the prereqs for physical therapy school. So I went to chiropractic school, and it wasn't until really probably my third year of chiropractic school where you're a junior and you get to go to the junior clinic and have them treat you. And so I started getting my spine checked every week, and it blew my mind because I'd had chronic severe allergies like every summer. I would get these debilitating allergies. My nose would plug up. I'd go through rolls of toilet paper. I was taking antihistamines by the truckload. And the only way I could get my sinuses to calm down was to go in a quiet room, put a cold compress on me and take a nap for a couple hours and I'd kind of come out of it. And it
Mm.
wasn't until I started getting regular spinal care that I noticed that my allergies had cleared up. There's something that I'd suffered with for almost 15 years, cleared up by having regular spinal health care. So I went, wow, I look back at my history and I go, man, this is amazing. And so I really dove into what it is that this profession does. And really it comes down to that's the study of things natural. And I'm reading a book right now. It's called Health at the Crossroads. And I tell our patients all the time, I go, "What's the difference between like a medical doctor or a chiropractor or, physical therapist or an acupuncturist?" I go, "It's the way that we think." And typically in medical land, they're going to think a couple different ways. One is if they have a problem, somebody has a problem, they're going to use medication, or if they have a problem, they're going to use a surgery. And so they're going to use a drug or surgery. And if you're not within that, then you're kind of crazy. So if you're thinking some other way, a lot of times people go, "Oh, that's just craziness." But in my training, it's like, okay, what can we do to help recoup the body's natural ability to heal itself? Because Pablo, you cut yourself, it's going to heal. You break a bone, you set it, it's going to heal. You get a sunburn, it's going to heal. You don't need intervention. Nature's going to heal yourself. And so that's the way we think and we understand. And so that's what really got me into this thing and excited. It's like, man, you've got this innate inability or ability to heal yourself as long as we can remove that interference to the expression of life. And so that's really why I want to get on podcasts and interview people and talk to people is to help spread that message that your body is a self-healing, self-regulating mechanism. Yes, at times in crisis, you may need medical intervention. And later in as we go along, I'll tell more about my story of how, that saved me. But really going back to it, it's like, how do we take care of ourselves? How do we get healthy? How do we live a long, healthy, vibrant life and not be subjected to pain and suffering and some of the traditional things that people think they need to do to create health in their body?
Okay. Why don't we take the time to actually go into that story a little bit? How did you almost die? Tell us about how
Well,
that
that's
happened.
that was a couple years ago. I've been in practice 30 years, and it was like, I mean, I'd work all day at the office if I could. I just if I could get my hands on as many people as I could, I loved it. It's energizing to me to see somebody who's hurting, they don't feel good, and then we do our magical thing, if you will. We adjust them, get them back into alignment. They feel better. They smile. They say thank you. It's the best feeling in the world as a provider to remove interference to their body, and then they go, "Hey, thank you." So I was working all the time. I had one of probably the largest practice in the state of Washington, and so a lot of people would come and see us. So we would see several hundred patients a day, and adjust them, and it was exciting. It was a fun time. It was great, and we got a lot of great results. And so, as you get older as a provider, you can't keep that pace up. And so basically, I started doing all the do nots. You shouldn't do this, shouldn't do that. And we ended up moving our office a couple of years ago to a new location. And that really I just got overloaded. And I actually developed AFib. I had no idea I had AFib. So my body was so out of balance. I had no idea. And then I was about 2 years ago, I was just chipping golf balls at the golf range and my heart went into tachycardia and my heart rate was about 270 beats a minute. So I walk into the front desk at the range, and I was telling the guy, I'm like, "Hey, I don't feel good. Call 911." And so there was actually a guy right next to me named Bob, who's a paramedic, and he's like, "What's going on?" I'm like, "I don't know. I'm super lightheaded. I feel like I'm going to pass out." So he went and sat me down on the couch and tried to do a bunch of, he's a retired paramedic, so he's trying to do a bunch of things to kind of get me to calm down, and I couldn't come out of it. So here comes paramedics. They're like, "You're in tachycardia. We're gonna have to shock you. We're gonna have to defib you." And they put me an IV, and they're like, "We're gonna give you some stuff so you don't feel it, but you're probably gonna feel it because we don't have enough time. So we got to get this done." And so they ended up shocking me. Felt like Mike Tyson just knocked me out. I saw this big flash of light, just bam. And then I remember is waking up probably 6, 7 hours later in the hospital with tubes in my mouth, and they started pulling the tube out, and I threw up. And long story short, apparently when they shocked me, my heart stopped for a few minutes, so they had to do CPR to keep it going. And my wife was there. It was kind of a chaotic thing, traumatic. So I look back at all that and I went, wow. That's the universe saying, dude, you are way out of balance. So that's how I almost died. And, that's why I want to get on here and tell people about, you don't have to go that far out of balance to go, man, I better make some changes. But I was so focused on taking care of people and working on the office and just doing that. I forgot to take care of myself. And so that's really what I want to tell people is, hey, you got to take care of yourself because, some people so from what I understand, there's only a 7% survival rate in what I went through. So pretty lucky to be here. And so I want to spread the message and, help other people be healthy. live prosperous, feel great, do what they love, hang out with their family, spread the word.
What's the most
Well, the cool thing with going through all this is I came out of AFib. All the doctors like it's going to come back. You need to be on all these medications. You need to do an ablation. Then you need to have a pacemaker put in. And I went, why do I, I wore an external defibrillator for 9 months. It was like a vest. And it looked like I was a tourist. I had this big old battery pack on my hip that I'd clip on. I played golf. And people are like, what are you wearing? I'm like, I have a defibrillator. So, if I go down, just let you know, you probably need to start CPR. But so I came out of AFib and my ejection fracture, normal ejection fraction for your heart is anywhere from 50 to 70%. Every time your heart squeezes, 50 to 70% of the blood should come out of your heart. That's normal. So I was down into the low, these high teens, which is considered congestive heart failure. So I was super low and I went through cardiac rehab. I strengthened my heart. I lost almost 50 pounds, changed my whole lifestyle. And now my heart ejection fraction is 62%, which is right at normal. So I'm out of AFib, normal ejection fracture. So I mean, that's really the exciting thing. All the doctors like, you're going to go back to it. You're going to do this. You need this. You're probably going to have another episode. If you don't have a pacemaker, you're going to die. And so I went, I'm gonna heal myself so I can be a testament for other people. Not that I'm out there wanting to be a cardiologist or anything like that, but my whole point is the body has the innate ability to heal itself. And I'll tell you this, Pablo, every time I went to cardiac rehab, they'd hook me up to a heart rate monitor and then they'd work you out because I was scared to get my heart rate above 80 beats a minute for fear that it was going to go into tachycardia again. So I was super fearful. And so when I went to cardiac rehab, building my confidence, and they were increasing my exercise load each time I would go in. As long as I was tolerating, they would increase it each visit. 4 months of doing that, I really got my confidence back of I can do these things. I didn't even want to walk to the bathroom because I would get short of breath and my stomach would get bloated. So I was in bad shape. So it's super exciting for me. I would always look at that heart rate monitor at rehab, and I'd go, there would be like 10 or 12 other people there. And I noticed everybody had a different heart rate. And so I would just look at mine and I would study what normal looks like. And I would just visualize that's where I want to be. I want my heart rate to be a normal sinus rhythm, not to have this abnormal atrial fibrillation type rhythm. And it came back into rhythm. It was just, it's an amazing thing. But, I let my body get so far out of balance. I was so focused on taking care of other people. I went, man, I got to be a priority. And so that's what I tell patients. They come in, they're stressed out, they're using their phone all the time. They're working overtime. They're not hanging out with their family. They're not eating good. They're not sleeping good. And that's just a recipe for some sort of, you know, major medical trauma to happen in their life. And so if I can help people, hey, unplug, let's get back to nature, reboot, and live life like we're supposed to. So many people are stressed out. I tell them all the time, you just got to calm down and breathe. There's a lot of things we can do, but that's kind of the message is, we have the ability to heal. And if I've been through it, anybody could go through it.
I love that. That's inspiring, brother. I love that. I love that. So tell us a little bit about, like, you started touching a little bit on, people are stressed out, not sleeping, not eating, looking at the phone too much. I'm guilty of that for sure. And you tell them, like, like, come in here, we're going to heal you. We're going to do the spine and stuff. But give us a little bit more, like, so two things. One is, like, who are, like, the top client? Like, who's your average client that is, like, the most fit to come and see you? And what are they usually suffering from that they don't know, that coming into a chiropractic clinic of all places
Yeah.
would fix them?
Yeah. So that's a great question because a lot of people have heard different things about the word chiropractic. And my specialty now, I still practice traditional chiropractic, but one of our specialties is focused on disc issues. So herniated disc, bulge disc, degenerative discs, somebody who's had a disc tear, even somebody who's had back surgery, disc surgery, disc, spine fusions. These are all things that we want to see people that have these conditions. And then I'll tell you, a lot of people go, "Well, why would I go to a chiropractor? I don't have headaches, or I wasn't in a car accident." And really, it's like that's just what a lot of chiropractors have promoted. My approach to this is the brain runs everything. It controls everything. It's the master. And your spine, the bones of your spine protect the nerve system. And so if there's any altercation in the way the spine's functioning, moving, misaligned, the joints, the discs are degenerated, it's going to create tension or pressure on the nerve system. It's going to alter the body's ability to function at its peak. And so we call it diminished capacity. And so I'll tell you, a lot of patients, they try all these other things and they come to us as a last resort. And I just know the story. They tell me they've been to they've been to their their medical doctor, and they've been to physical therapists, they've done acupuncture, they've done massage, they've done all these things, and they come to us last resort. They spent all this money. They might have had shots and injections, and they're like, "Fix me." And they've been dealing with something for 20 years. I can't tell you how many times people wait way too long before they come to see us. And then usually the biggest thing, Pablo, is patients will come in and the number one thing I'll see is they're not sleeping good. And you just go, and the number one thing when you start aligning the body's brain and nerve system and spine, the number one thing they tell me is they slept better. After their first treatment in the office, I go, "Did you sleep better?" And 95% of them will say, "Yeah, I slept like a baby." And that's because you're taking the stress off the mechanism that controls function. So if you can give that nerve system a chance to rest and recoup and have, downgrade and recover and reduce that cortisol, it's gonna help their body relax. They're gonna fall asleep. I just had a patient this morning that she's been a patient of mine for probably 10 years, and I still clearly remember maybe 5, 6 years ago. She came in super messed up with her low back, pain into her leg. We put her on the spinal decompressor table, and I walked up to her to check on her, and she was asleep. And I leaned into her and I'm like, "Hey, are you asleep?" And she kind of, woke up and she's like, "Wow." She's like, I haven't fallen asleep like that in 3 months. And I went, wow, just even in the office, just being able to relax and take that tension off the body, she was just able to doze off. And I always tell people it's kind of like when you let go of the luggage that you've been dragging through the airport, you finally let go of it and you get that sign of relief, like, ah, and there's in my mind, there's no other feeling I that I've experienced where you could align somebody's spine gently, it's not nothing crazy, it's gentle, and they just go, "Wow, that feels good." And that's really what our approach is. We want them to leave feeling better than when they came in.
All right. So what you're saying, what I'm hearing, is that a chiropractic clinic is not just about your back, and it's not just about discs. It sounds like it's about stress and headaches and just regular pain elsewhere. It doesn't just necessarily need to be a back pain issue, right?
Correct,
So
correct.
if you had 1 minute, if let's say you were in a stadium in front of 100,000 of Washington citizens, and you had 1 minute to give them a tip, and they don't know anything about chiropractic. Maybe they have, maybe they haven't. Just general knowledge. What is one thing that you could leave them with if you only had 60 seconds to tell?
60 seconds. Well, I would tell them, take care of your frame from from the base of your skull to your tailbone. Take care of that. Take care of the joints of your spine and nerve system because you only get one shot at it. If somebody's had surgery, it's not going to be typically their last. It's kind of like potato chips. Once you've had a spine surgery, usually you have to have more. And a perfect example of that is Tiger Woods. He had 5 back surgeries and not playing golf like he was. Hulk Hogan had back surgery, he had low back surgery, is paralyzed for a while. Then he had neck surgery. And I don't know if that was what contributed to him not being able to breathe, which created his ultimate passing. But all I'm saying is if we take care of our frame, the patients that I've seen over the years that take care of their frame, you got to have a good person to do this. There's good and bad in any profession, and obviously you got to find a good uh, a spine doctor that can take care of your spine. that can help it function and help your nerve system stay connected. And it's an art, So, and somebody who's into the philosophy that they understand that the body heals itself, and what can we do to help support that recuperative healing power. And it's not just getting adjusted. There's other things, whether it's cleaning up the toxins in your environment or cleaning up your thought processes or helping minimize traumas to your body, especially these chronic repetitive traumas. Nowadays people have these cell phones, they've got computers, they sit, they say sitting's the new smoking. So just helping, having some type of healthcare provider that can help support you in those quests of reducing thoughts, traumas, and toxins, which ultimately is going to create dysfunction in the body.
Beautiful.
That
I
was a
love
little
it.
longer than a minute, but you get the point.
Yeah, absolutely. No, that's a good one. And what would be so I was gonna say, how do you take care of your frame? But you kind of touched on it a little bit. But are there some specific steps or maybe a couple tips that you would want to give?
Yeah, I mean, I I would recommend. I love doing foam roll. I love doing that every morning, getting my spine into extension. Most people, if you look at people as they get older, they tend to age and they lean forward, and then eventually they need a cane, and then they need a walker. And innately, that's your brain saying, "This is the only way I know how to reduce the tension on my spinal cord is to have forward head shift." But I see kids now, and I have one right now. Mom's got him in a like it looks like a trike. It's got a handle on it. I'm gonna call it a wheelchair, but she's got a seatbelt on him. It doesn't have pedals, so he can't pedal it, and he's got a cell phone, and he's sitting in this trike, and she's pushing him around. And it's like it's very easy for mom, but a 3-year-old's gonna run around. But this guy's got a cell phone, he's sitting, and it's like, man, it's starting earlier and earlier and earlier. So anything we can do to keep the spine moving, the low back is the locomotive for your legs. And I always tell people, you lose your back, you lose your legs, you lose your freedom. And so it's really all about that. And I see these patients who have been coming to us for 10, 20, 30 years. And I have one guy, he's been a patient of mine almost 30 years. He's in a group of men, they're retired teachers. He's the only guy in the group that's never had a neck surgery, a shoulder surgery, a knee surgery, a back surgery. And he's also the only guy in the group that he gets his spine checked regularly. And so there's a lot of things we can do, but having a good person that can help you tap into this innate healing power is what it's all about.
It's not just the back pain. It's like the pain in your entire body. And now beyond that, it's like the way that you have thought structures and like the way you have thought processes. Being aware and conscious of what are some of the things out there that are causing this pain, whether it's a headache or whether it's even sitting down. I remember having pain in my coccyx for several years, like because I sat down too much. I
And changing your physiology, like sitting all the time, yeah, that's a certain physiology, which is gonna have a certain effect. So if you change that physiology, you're gonna have a different effect. Same thing if like, I'm not gonna pick on, like, soda, but if you drank I had a guy that was drinking 2 liters of soda every day, had headaches, and he was overweight and all that. I'm like, "Dude, you gotta get off the soda." And what do you know? He got off the soda, started drinking water, and his headaches went away. I'm like, so the physiology of drinking those sodas is what led to headaches and being overweight and all that. So it's just when we changed his physiology, he had a more pleasant outcome, if you will. And I love what you said about thinking because if you let's just pick on headaches for a minute, but if you look at a headache, one way to think about a headache is, man, I'm low on Tylenol or I have an Advil deficiency, so I better take some Tylenol or I better take some Advil. Another way of thinking is like, well, maybe I'm dehydrated, so I should drink some water. Another way of looking at it is, man, maybe I'm really stressed out. Maybe I should reduce my stress load. As a chiropractor, you go, maybe you're misaligned in your neck. You should get adjusted. So there's lots of ways to think about, and none of those are necessarily the wrong way, but it's just like people have been so ingrained to only think medication and surgery, but it's like, and if you think outside of that, you're like crazy, but it's like there's so many other ways of thinking that it's not the two medical ways of thinking, if you will.
yeah, the Joe Dispenza. Are you familiar with Joe Dispenza?
Yes, yes.
Right? like think about this from a completely different way that you've never been taught before, and it gives you he introduces all this new information that you're like, wait a minute, that sounds way too out there. That's woo woo, right?
Yeah.
But that
Yeah.
woo woo stuff starts becoming real, and you're like, oh, whoa, wait a minute, what's going on?
Well, that same thing when with my heart, I'm like, because all the doctors like, you got to do this, this, and I'm like, I didn't do 90% of what they told me to do, procedure wise and medication wise, and I'm like, and I still remember just looking at that heart rhythm thing. I'm like, what do I got to do to get me back into natural rhythm? Because I was so far out of balance, and it's like, how do we get our body back in balance? And sometimes you might need medication to help that, but I think the goal is, how can we look to nature to restore health in our body?
Incredible. All right, brother, we're almost up to the minute here,
All
and
right. I mean, we
yeah, I
could
think
go
this
all
is
day on
great.
this stuff. You know what I
Yeah,
mean?
for sure. Yeah, that's
We
what
could
we
deep dive in all this. That's why we'll do a bunch of episodes and,
exactly. Yeah, otherwise,
tell
yeah,
the
well,
story.
yeah, exactly. So actually, my that was my final questions. But what were some of the things that listeners should expect in the next several episodes? Like, we're gonna dive deeper into a few things, obviously, that we just talked about. But what are some high level things, some topics that you can share now that listeners could expect to listen in the next few episodes?
Well, the 3 things, the 3 T's I call them, that create high levels of cortisol, stress hormones. It's our thoughts. We can talk about how to create better thoughts with affirmations, like saying stuff like, "I am healthy. I feel healthy. I act healthy." So our thought processes. The other thing, even meditation, you throw that in there. The other thing is toxins. What are we doing to create less toxic load on our body, whether it's, you know, a medication or a pesticide or something that we're breathing or the water we're drinking or something we're putting on our skin. So just help, what can we redo to reduce the toxic load onto our body. And then the other thing is traumas. What do we do if we have traumas? How can we reduce trauma to our body? So those are some of the things that we can dive into, and there's nutritional things we can get into, and different stretchings and exercises and different lifestyle things to change your physiology to create a healthier vibration, a healthier you, so you can express, I don't want to sound woo woo, but express your potential better. You know what I mean? With me, when I was in AFib and I had the tachycardia event, I was not expressing my full potential as a human. It sounds cliche, but I was like, yeah, what can we do to just shift our body in a healthier direction? Because if we're not focused on health, what's going to show up, the opposite of that.
Now, but people ask, I think, because I was doing a bit of research, but when it comes to going into the chiropractic clinic, it seems a little bit scary sometimes because it's like, oh, I don't know, I hear cracking, I'm scared. Like, what do you usually say to those people that are like, they're kind of on the fence? They're like, yeah, I'm looking into it, but it looks a little bit scary. I see like this could work, but I don't know if it's for me, and they get the shivers.
Yeah, I mean, there's a lot of people that watch YouTube, and there's some crazy things that are out there that, you're not doing that to everybody. Maybe a young, flexible, healthy person, but somebody who's in their, little more mature in life, has had some trauma. They're very guarded, if you will. So a lot of times I'll tell them, I'll take my finger and I just pull it I'll take their hand, I'll just pull it real gently. And I'm like, is that okay? Does that feel okay? And I'll show them that we can help mobilize the joints of the spine, help open up the nerves. And it actually feels good. That you're not doing a karate chop, you're not doing kung fu on them, you're not doing some crazy, rapid move. It's very gentle, very slow. And the research shows that the low amplitude, low velocity movement actually gets better results, especially if you've got people that have complicating factors and different comorbidities. The gentler, the better. But again, we're trying to stimulate that physiology to move in a healthier direction. And so I always tell patients, we're gentle. We go to your tolerance. We've never had anybody get hurt in our office. So, I always say, find someone who's gentle and who cares.
I love it. Cool. Yeah, I've never heard of that. That's beautiful. That's a beautiful way to put it. All right, let's wrap this up and just tell us where to find you, Dr. Troy. How do we go in if somebody's listening to this is like, hey, you know what? I want to go in to get my back checked, or I have headaches or whatever. I want to go in and check this out. Where is the location? of the clinic, where can they find you and how can they get started?
Yeah, we're in Vancouver, Washington, USA, just north of Portland, Oregon. And I've got a couple different websites. Vancouver Disc Center is that's our disc center website. And then we also have kind of an umbrella website. It's called zenaptic.com, Zenaptic.com. You can see all our different umbrellas and brands there. That's a great way to find me. The other thing, I'm on TikTok, Vancouver Disc Center. I also have T Roy Golf, kind of into golf, been coaching some kids and just having fun with that because my book's coming out. It's called How Not to Die at the Range, at the golf range. So I'm having fun with playing golf, teaching and learning that. And golf's kind of very metaphoric for life. So looking forward to talking more about that on our podcast. Or also you can find me at T Roy Golf as well. So I'm out there. TikTok, Facebook, Instagram, we got it all going on, We're just having fun.
Nice, nice. Yeah, I noticed that. Yeah, you're all over the place. That's great. All right, and all the links will be in the description below anyway. This has been a pleasure. Thank you, Dr. Troy. And until next
Thank you.
time, we'll see you guys on the next episode.
All right. Thank you.